HAIL, a way to improve health access for independent living. Featuring Renita Wilkes, independent living specialist at Independence Inc. in Lawrence, Kansas.
People with disabilities can be healthy. That statement is not rocket science, but to many people it is big news. Because having a disability has often been linked with being sick, and that's just not how it is. People with disabilities can be healthy just like anyone else. Hi, I'm Renita Wilkes. As a person with a disability who works for a Center for Independent Living, I understand how important managing health is for consumers who want a more active life. In my own life, I've dealt with issues with chronic pain and fatigue. A few years ago, after experiencing severe pain, joint pain in my hands, I went to see a specialist for help. The response from the specialist was, you use your hands as your feet, and it's not going to get any better. It was as if he said to me, take 2 aspirin and don't call me in the morning. I left that appointment feeling devastated and depressed, but I realized that if I wanted to maintain my quality of life and stay active and independent, I had to take control of my own health-related goals. So I went to see another doctor who helped give me the answers that I needed to feel better. And there are things we can do to improve our health. HAIL, or Health Access for Independent Living, is a program designed to help people with physical disabilities set and achieve some health-related goals so they can be more active. HAIL focuses on 3 conditions that are problems for many people with physical disabilities: depression, fatigue, or feeling tired, and pain. In addition, HAIL also focuses on skills related to better communication with your healthcare providers, management of medications, and other skills. How does HAIL work? It provides useful health information to people with physical disabilities through a trusted source. And that trusted source is an independent living specialist like myself or other SIL employee who embraces the independent living philosophy of nothing about us without us. So I hope that you would consider using HAIL to enhance your independent living, because helping you to stay active and independent is what HAIL is all about.
To learn more about HAIL, contact the Research and Training Center on Independent Living, RTCIL at ku.edu, or 785-864-4095. The contents of this video were developed under a grant from the National Institute on Disability, Independent Living, and Rehabilitation Research, grant number 90RT5015. NIDLR is a center within the Administration for Community Living, Department of Health and Human Services. The contents of this video do not necessarily represent the policy of NIDLR, ACL, or HHS, and you should not assume endorsement by the federal government.